Hi, my name is Catherine D'Ambrosio, and this particular blog entry addresses nursing care staffing ratios in skilled nursing care facilities. I encourage you to interview any facility that you're considering placing your elder in regarding the nursing care staffing ratios. It's the most important thing for you to consider is the nursing care that your elder will be receiving in this facility. There are lots and lots of ways that facilities can kind of dodge your question and pad their answers. And I want you to be able to cut through to the heart of the matter and find out the actual patient care ratios. So who is your elder going to be able to have access to? The first question that you'll ask a facility, or that I recommend that you ask a facility when you're interviewing them, is how many nurses per patient is normal. And so this is not the number of nurses, RNs, LPNs, or nursing assistants that are employed by the facility, because a lot of nurses work part-time, a lot of them work per diem or on-call. And a lot of nurses are employed by facilities just to fill out paperwork for reimbursement purposes. So those nurses are not going to be providing direct patient care. And what you really want to find out is how many nurses are providing patient care to your elder. Many states do not have minimum staffing ratios specified in state laws. And so it is not outrageous in such states to have nursing care facilities where an RN will have up to 90 patients and an LPN will have 45 or 50 patients that they're passing medications to. And nursing assistants can have somewhere between 10 and 15 patients. These are outrageous staffing ratios and not acceptable. I would encourage you to not consider placing your elder in a facility where they're not likely to receive decent nursing care. And you cannot provide decent nursing care to 90 elders. It's just not possible. So look at the facility's actual nursing staffing ratios, not what's planned or not what they say is optimal. What were their staffing ratios, or what are they today? What were they yesterday? What were they last week, last month, last year? And I've got a little chart here for you to fill out so you can take notes when you go to each facility and be able to compare one facility with another. Make sure that you understand how these staffing ratios break out for each shift. So typically, day shift will have a higher staffing ratio than evening shift, and evening shift will have a higher staffing ratio than night shift, because typically people sleep at night, they don't need to be bathed, they don't need meals, they don't need to be up and about as much at night. So the staffing ratios are lower. Same thing on weekends. So the weekend night shift is generally the lowest staffing ratios, and the weekday day shift is usually the highest staffing ratios. Awards that nursing homes try to push at you, I think they're interesting, but I think most of the nursing home awards that I've seen are more marketing gimmicks than anything else. I don't know of what meaning or interest their awards might be to you, but certainly they're a marketing tool in most cases. Another thing that I would like for you to inquire about is how many master's prepared nurses do they have on staff, or do they have on a retainer of some sort at the facility, and how often do the master's prepared nurses provide in-services to the nurses and nursing assistants in the facility. How many of the nurses employed in the facility are certified in gerontological nursing or in wound care? How many nurses in the facility attend education and training seminars? How often do the nursing assistants, how often are they offered education and training seminars on basic nursing care? And what types of training seminars do they offer? So that's about it for staffing ratios. I hope that this has been helpful, and thanks for stopping by. Bye.